Hello and welcome to another edition of Currently in Quincy. I'm Joe Catalano, and on today's program, we're hoping to chat with Quincy Health Commissioner Ruth Jones and get an update on the coronavirus crisis and how it's impacting the city of Quincy. First, though, we check out the weather and the news for you this morning. Currently in Quincy, it's cloudy out there. 37 degrees right now, and this afternoon, look out for some rain and maybe a little wet snow moving in through this evening. Maybe a coating, maybe an inch or two through the overnight hours. Highs today only in the upper 30s. Temperatures pretty steady tonight, mid to upper 30s. Tomorrow, a much different day, probably the pick of the week with the sun and clouds. It'll be milder, so any snow that does fall will melt. Highs tomorrow into the low 50s. More rain arrives on Wednesday afternoon. It'll be a cold rain, too, with highs only in the lower 40s. The rain will linger into a Thursday morning with highs Thursday into the mid-40s. Looks like some more showers are possible here on Friday. Right now, they're just cloudy and 37 degrees in Quincy. In the news today, if you have not yet heard, Governor Baker just this morning ordered a shelter-in-place advisory for all of Massachusetts, and that goes into effect today and lasts for the next 2 weeks, except for essential services, and that includes, of course, grocery stores, convenience stores, and pharmacies that will remain open. However, he has also advised the limited number of group gatherings to 10 people rather than 25. So those are the latest advisories from the governor this morning. Again, a shelter-in-place advisory for the next 2 weeks here in Massachusetts, and limiting the gathering of people to no more than 10 per group. And we hope to talk to Ruth more about what that means here in Quincy a little later on this morning. Elsewhere in the news, the Quincy City Council has unanimously approved using $500,000 from the snow and ice removal budget to purchase personal protective equipment as Quincy's first responders ramp up to respond to the coronavirus crisis. In its first ever teleconference special meeting that was held back on Friday afternoon, City Councilors said it's important to provide safety gear for people who will be on the front lines of the pandemic. Some of those funds can also be used to purchase a tent that could be used as a drive-through testing site for the coronavirus, potentially at the former Quincy Medical Center. Mayor Thomas Koch says the Army Corps of Engineers would be needed in order to reactivate that former hospital on Whitwell Street, which has been closed for over 5 years. Mayoral spokesman Chris Walker said that such a testing site would follow some strict guidelines.
The testing would work if people. What I think we can make an assumption for is that any testing facility, even a drive-through type, is not going to be the kind where anybody who just feels like they have a cough or a cold that they're going to go up there and get a test. I don't believe that will at any point be advisable. I know some people would like to see that happen or feel nervous or have anxiety about that, so they want to have a test. It's not under any circumstances going to be a testing free-for-all. There will always be criteria that people will need to have a test done.
There are currently 13 cases of coronavirus here in Quincy. In his latest coronavirus update, Quincy Mayor Thomas Koch reiterated a statement from Governor Baker that there was no shelter-in-place order back on Friday when the mayor produced this video. But Koch is urging people to practice good social distancing and good personal hygiene while also supporting local businesses.
There are a lot of rumors been flying, folks, about national shutdowns, state shutdowns. Both the national and state leaders have indicated that's not happening. California, it's happening. In New York, it's happening. I just think we want to make sure we keep ourselves from getting into a panic or real fear. Let's keep calm about the situation. Massachusetts now has about 413 cases, and in Quincy we have our 13th case confirmed. We're a city of 100,000, 13 cases. It's certainly manageable. We encourage people to please continue to use good practices as been described by the CDC, by the Department of Public Health, to keep the transmission of this disease limited. And that is the goal of the social distancing, avoiding social gatherings, and being smart. Continue to use good practices, washing your hands, and limit interaction with others. Please check in on your neighbors, particularly the elderly, if they need something. Supermarkets are open, pharmacies are open. Please do that.
And again, just this morning, the governor did issue that shelter-in-place advisory for the next 2 weeks. Last week, the Quincy Affordable Housing Trust Fund did unanimously approve a request from the mayor to use $1 million from the trust fund to help pay the rent for people who are out of work because of the coronavirus crisis. That fund will be administered by the Quincy Chamber of Commerce and Quincy Community Action Programs. The exact details are still being worked out. And now that you're up to date with weather and news, check out our programming lineup for later on today here on Quincy Access Television. Starts with a replay of this program currently in Quincy today at 5 o'clock. FYI from the Quincy Health Department at 5:30 with an update on the coronavirus. AM Quincy tonight at 6 with the Commissioner of Natural Resources, Dave Murphy. 6:30 AM Quincy, it's Emily Lebo from the Quincy School Committee. Tonight at 7, Quincy honors World War II veterans.
Not forget the sacrifice of this generation.
At 8:30, the Thomas Crane Public Library presents The Guy. And at the library concert tonight at 10 featuring Haley Hewitt. And tonight at 11 on Channel 8, join us for Democracy Now! A reminder for you that regular programming on Channel 9 has been suspended. That's in order to bring you the very latest information on how the coronavirus is impacting the city of Quincy. If you'd like to get a complete program schedule, go to our website. It's qatv.org. When you get there, click on Program Schedule. And do like us on Facebook and follow us on Twitter as well. Check out our weekly ad in the Quincy Sun when they resume publishing on April 19th. Coming up, we hope to chat with the Quincy Health Commissioner, Ruth Jones, get the very latest on the coronavirus crisis. That's next. Welcome back. We welcome to the program over the telephone this morning Quincy Health Commissioner Ruth Jones as we're maintaining our social distancing guidelines. Ruth, thanks for joining us. Good morning.
Good morning, Joe. How are you?
I'm doing well. The better question is, how are you, and have you had much sleep yet over the weekend?
Not a lot, but I'm getting used to it. Yeah, we're quite busy here at the health department, as expected.
I'm sure. Of course, I'm sure you're well aware the governor just this morning issuing the shelter-in-place advisory and lowering the number of people that should gather in groups to 10. What is your reaction to all that?
I think it's a good idea. I think we've been doing that somewhat in Quincy prior to the governor's order, but I think it's wise of the governor to, prohibit the gatherings of more than 10 people. If you remember, we were at 25 prior to this, and then restricting who can open as far as essential services. So I think it's a wise idea. I think one of the things that we have to remember is that social distancing, and I think it's one of the most positive ways of preventing the spread of this disease.
How will this order from the state specifically impact Quincy, Ruth? What businesses would be impacted?
So there's a specific list of essential services on mass.gov that will be making people aware of these. It won't affect the restaurants that are right now doing takeout and delivery only. They can continue to do that, but it will be some of the other retail stores. Again, there will be a list published that what is considered to be essential services, and it's mostly food establishments, grocery stores, physicians' offices, and those type of things will all be considered essential services. So a lot of healthcare, public health, human services are considered essential. Law enforcement, public safety, first responders are considered essential. food and agriculture businesses would be considered essential, and that includes liquor stores under that, but there's a whole list under that. Under energy, the electricity industry is obviously considered to be an essential service, as well as some IT and environmental remediation businesses would be under there. Petroleum workers are considered essential. Natural and propane gas workers are considered essential. Steam workers. So it's quite a long list of those that are actually essential. Includes waste and wastewater.
Mm-hmm.
A lot of the transportation, the buses, the T. Truck drivers, obviously, because they're bringing in our food and our supplies. So that would be a necessary service. Public works is necessary. We said communications and IT facilities would be considered necessary. And then there's a list of other community-based essential functions in government operations, and so there's a whole list of them that people should take a look at. Go to mass.gov. It's too lengthy of a list to go into right now, but it's on mass.gov, and it tells the specifics. And we will be putting some information, obviously, on our city webpage, where people can see it and easily go to that link and know what can stay open and what can't stay open.
Sure, yeah. Have you had any guidance from the mayor yet about what will be happening with city departments? I know that the offices have all been staffed, although they're closed to the public. Do you know if that will continue?
Right. I have not had the chance to speak with the mayor yet. We're actually having a meeting through Zoom, actually, not in person, so we can keep our social distance with all our department heads, and I'm sure the mayor will give some specific guidance on what city offices would be open, which ones would be closed, that type of thing.
So what, Ruth, is the current situation with coronavirus here in Quincy? I know as of Friday there were, I guess, 13 confirmed cases?
Right, so we've gone up a little bit as we had expected to. We now have 16 cases. One is a suspect. The rest are confirmed.
Okay.
We've unfortunately had one death, an elderly gentleman that was in one of the hospitals in Boston, who had a lot of underlying medical issues. He was in his 80s, and he was a positive. Identified as a positive COVID-19 case, and he expired over the weekend, and our prayers and thoughts go out to his family. And we've also, on the positive side, had 3 people that actually have recovered out of that total of 16. And so these people finished their quarantine, have done well, have had no symptoms, so they are now off quarantine.
Okay. And about how many folks are still kind of self-isolating, under quarantine, just in case?
So we have the rest of these cases that would be still self-isolating, and we probably have probably about 60. I don't have an actual count.
Okay.
And these are all contacts to cases that would be self-quarantining, self-monitoring. We're monitoring them also via phone for any symptoms or any fever. So far we have had nobody that's had major issues, so we're in the process of doing that. And again, these are mostly contacts to these confirmed cases.
Right. And are you hearing that the increased testing is happening, and that is the reason we're seeing more cases?
Yeah, I really think that. I think we expected that, and I would expect that we would get even more cases because they are trying to increase the amount of people that they test. But one of the things I think I want people to be aware of as far as testing, there is particular criteria that the state and the federal government has put on who gets tested and who doesn't get tested. And that is so that they can use the tests that they have here effectively and test the sickest people so that we can make sure that we're getting to the people who need to be treated right away, and also to test healthcare workers so that they can quarantine if they need to, and then go quickly back to work as soon as they can. So these are the people that are on the top of the list of criteria to be tested. Also, you will not be tested unless you have a doctor's letter. It's one of the other things that's required as far as testing. So I think we get a lot of calls during the day, people saying, I'm not feeling good, I have a runny nose, where can I go get tested? We're not at that point where you can just walk in and get tested anywhere. The supplies are still very limited, the personal protective equipment, and those people that do the testing need to really gear up in full gear in order to do the testing. So they are trying to prioritize to make sure that those that absolutely need to be tested, so that would be healthcare workers and those that are the sickest, particularly hospitalized patients, get tested first so that we can make sure we're reaching the people that we need to reach while not overburdening the personal protective equipment that we already have. Right now, we do not have any testing sites in Quincy. There are several different testing sites in Boston, and I know some of the hospitals are doing testing, but again, that criteria that I just spoke about holds true for all of these testing sites.
Okay, right. The guidance that I've heard from folks in the healthcare industry is really they don't want you to go to the doctor unless you're very, very sick, right?
Right. You should call your doctor. You shouldn't just walk into an emergency room. You should call your doctor. Even if you're going to one of the freestanding clinics that are all over Massachusetts, you should really call them first before you go in. And they can decide what they want to do if they want you to come in and test you. Oftentimes you're tested for flu. And
right.
If they find out that you have flu, you probably would not be tested for COVID-19. So you really should make contact with your healthcare provider and let them know what's going on, what symptoms you have, do you have a fever, that type of thing. And then they can guide you. Your healthcare provider can guide you more as to what you should do and what you should not do. Now, obviously, if you're home and you're experiencing these symptoms and you're having difficulty breathing, you want to call 911. And have them, take care of. We don't want somebody sitting at home with in respiratory distress, severe respiratory distress, without getting in touch with someone.
Sure. We've heard the stories about the shortages of, face masks and gloves and gowns. Are you seeing that in your realm here in Quincy?
Absolutely. We're seeing this across the board in Quincy. Doctors' offices, emergency rooms, our freestanding clinics. We don't have a lot of personal protective equipment here, and we're the ones that would give out masks to those that have to be quarantined. So, and masks for our first responders.
Right.
All the equipment for our first responders, our police, our fire, and Brewster Ambulance. We are getting enough as each day goes, but we are getting down to having a shortage, and hopefully, I know there's some masks and personal protective equipment coming from the federal government, but we have not seen it here yet.
Can you give a little insight, Ruth, into what folks in the healthcare field are seeing with this pandemic right now, and what they're looking for in terms of signs of improvement?
Yes, so the symptoms of COVID-19 vary. We're seeing younger people that are still getting it, and in some states, actually, we're seeing the younger people are getting sick, where the younger cases that we've had here have had very few symptoms and recover very quickly. We are seeing the older people over age 70, being hit hardest by this around here. And again, there's still some things we don't know about coronavirus, so we don't know as far as infants and young children, if they can carry it. The whole social distancing issue is very important because kids may not display any symptoms of this, but if they are a carrier of the virus, could bring it home to grandma and grandpa who could get very sick from this. And we are seeing older people with different underlying chronic illnesses are the ones that we see getting the sickest from this. And I think, if you talk to any of the hospitals, that's what they're seeing also.
Yeah. When will we kind of know when, the worst has come and gone, when things are on the upswing, if you will?
Well, that's a good question. I'm not sure. You hear all sorts of rumors. Well, we're 2 weeks behind Italy, so in another week we're going to see the worst. And
Right.
I don't know. I don't have an answer to that.
Okay.
We're still seeing, steady cases come in. We're obviously seeing more cases because we're seeing more testing. We are having people recover. In other words, they go through their quarantine, don't have an issue, and still keep in mind that there's a good portion of people that get this disease that it's very mild, and they recover fully.
Right.
Again, we're seeing more issues and deaths usually in the people with coexisting underlying health issues, and usually over the age of 70. So I don't know how long it's going to be. I don't know when this is going to end. We'll know that we're on the down slope when we start seeing less cases, but right now we're ramping up testing, so that's not going to happen. So I don't have an answer for you on that, Joe. I don't really know.
Okay, yeah, that's fair enough.
Yeah.
Ideally, though, Ruth, what would be an adequate number of tests? I mean, I know the governor had mentioned he'd like to see at least 3,500 per day here in Massachusetts. Would that give the healthcare workers a good kind of idea as to how much the virus exists here in Massachusetts?
Well, I think the more tests we do, the better.
Okay.
Because then you're going to see how many people, actually have it, and what the age range will be, and how many people are recovering quickly. So I'm not sure I can put a number on that as to how many tests. I think that the more testing we do, the better. But right now, because of the lack of personal protective equipment and test kits, we have to organize it so that those that need the test mostly are the ones that are going to get it. And obviously our healthcare providers, it's really important that we test them and get them back into the the healthcare facility as quick as possible. If our healthcare providers all start going down and getting sick and being quarantined, then we're going to have a huge problem. So.
Right, yeah. There has been, as you know, discussion about a possible drive-through testing site here in Quincy. Would your department be a part of that if that were to happen?
I'm not sure if we'd be involved in some aspect. It would, a drive-through testing site. Again, one of the things that you have to have, two of the things that you have to have people to man the site, so you'd need nurses, doctors, people that are trained in doing the swab to actually be there to do it, and you need personal protective equipment to do it, plus the money just to open up, the site, the tents, and all that. But I think the biggest hurdle right now with that is the personal protective equipment and the testing kits, because those are the two essential things that you need to open that up. Again, the criteria would still, pertain to those testing sites. One of the great things about a drive-through testing site is that a person can keep their personal protective equipment on for a longer period of time, because people aren't getting out of the car. You're not having physical contact other than a short period of time while you're doing the swab. So it helps to make the personal protective equipment go further that way. You're not using as much. So it's something that we've talked about. It would be great to have one, but that's kind of still in the stage of discussion as to how logistically we would put that into effect.
Sure. The mayor did mention on Friday that the health department here in Quincy is now being staffed around the clock. Is that right?
That's true. My nurses, my two nurses and myself, actually all our phones are transferred to our cell phones over the weekend and at night. So, we respond to calls 24/7. We've been here. My two nurses and myself have been here 7 days a week. and when we're home, our phones are available so that we can pick up when somebody calls the office. And we also have other staff here in the health department. We're rotating our staff so that we have other people to help answer any calls, and if we have to put out any flyers or do anything like that, we can manage it with our staff here.
Very good. Have you heard? Are there any issues with the businesses here in Quincy complying with the ban that's currently in place?
I think most people, we're doing okay. We have an issue here and there. We're working with the city clerk's office and Detective Mark Folan, who works through the city clerk's office, to make sure that people are doing what they should be doing. And we get occasional complaints, and we will respond. Either us or the city clerk's office will respond to those complaints. Hopefully we'll make sure that everybody's doing what they're supposed to be doing as far as, not having people sit down and eat or drink. They can do only takeout or delivery, and basically keeping that social distancing of 6 feet or more between people, particularly in these food establishments. I also want to mention, if I can, Joe,
Sure,
that
yeah.
we get some complaints about people with the supermarkets, and that, how come they can let so many people in a supermarket, but they can't in a restaurant? So
Yeah.
the issue with a supermarket is it's considered people in transit. So for the most part, people are continuously walking through a supermarket. You're not spending a lot of time with somebody face to face. You may be spending a little bit more time when you go to the checkout, but you still are in movement. And we want people to remember that close contact is somebody that is within 6 feet of you for a time period of 15 minutes or more, and
Okay.
that's when we see most transmission. So supermarkets, generally, you're moving, you're getting in, you're getting out, that's why there's you can have more people in a supermarket facility, because of the fact that people are hopefully continuously moving.
Okay. And again, all the personal hygiene suggestions still apply, right?
Absolutely. Wash your hands, wash your hands, wash your hands.
Yep.
I can't say it enough. Purell and the hand sanitizers are great to use in between, but they don't take the place of hand washing at a sink with warm water and soap. 20 seconds, 2 courses of happy birthday, if you don't know how long that is. And until you can, if you're out and you're doing your grocery shopping, until you can get home and wash your hands, keep your hands away from your eyes, your nose, your mouth, away from your face, because germs can get into your respiratory system that way.
Sure. Anything else, Ruth, you'd like to tell the folks here in Quincy?
Well, I just think that people need to be aware, this is a serious situation, but we're not panicking. I think that we are, working with the state Department of Public Health, the CDC, with our local, city departments to make sure that people are kept as safe as possible. One of the things we want people to realize, that even though you're home and you may be, with this new stay-at-home thing from the governor, that don't take it as this is like a snow day or a play date. Social distancing is important. It's good for people to get out and go for walks, take your dog for a walk, to exercise, ride bikes, but you want to make sure that you're keeping that 6 feet away from another person, because that social distancing is so important. This is not a good time to get all your children's friends from daycare or school and have a play date, because that's just doing the opposite of what we want you to do.
Okay.
Okay?
Appreciate your time. Great to talk to you, Ruth.
Thank you, Joe. Thank you. Thanks for helping us get the word out. We appreciate it very much.
You're very welcome. And to you and your family and staff, be well and be healthy.
Thank you. And to everyone, stay safe. We're here. And if anybody has any questions or concerns, they can call the health department at 617-376-1272, and we're happy to answer any questions.
Great. Thanks again, Ruth.
Thanks, Joe. Have a great day.
You too now. Yeah, bye-bye.
All right. Bye-bye.
Quincy Health Commissioner Ruth Jones joining us on the phone there. Gives us just enough time to take one more look at the weather forecast for you for the rest of the day. Today, had a gray and damp out there. It's 37 right now. Look out for some showers blowing in this afternoon, and they could switch over to some wet snow this evening, maybe a coating on the ground or so. Lows tonight in the upper 30s. A little better tomorrow, sunshine and warmer, low 50s. More spring showers on Wednesday afternoon right into Thursday morning. It's kind of damp on Friday right now as well. Thanks going out to Ruth Jones for joining us on the phone today. Thank you to our crew, and thank you for watching. For all of us here at Currently in Quincy and Quincy Access Television, be safe and be well, and we'll chat with you soon.